I wanted to talk to you guys today about one of the services that we offer. It's Bioidentical Hormone Replacement Therapy. So if you're not familiar with that, what it is a hormone supplementation, and the chemical structure of these hormones is the exact same as that's in your body. So for those of you that don't know much about hormone supplementation is not gender specific. So a lot of times people think it's more for women going through menopause, which is true, but there is also something in men called andropause, where men start to lose testosterone. In fact, once men hit the age of 35, you start to lose testosterone by 1% per year. So it's a steady decline over that time, whereas women is more of a drop off, but all the same, you're still losing hormones. So some of the symptoms that go along with that are low energy, low libido, poor sleep quality, you feel like you're killing yourself in the gym and you're eating healthy and you're doing all the right things and you're just barely maintaining your weight and you're not building muscle at all. A lot of times that's a testosterone issue. So that's a big one, I think, that both men and women experience. So we look at blood levels to assess whether or not you need one thing versus another, and we can decide, what your cocktail is that works best for you. We like to use pellets. It's pellet therapy. So these are these tiny little pellets of hormone that are inserted into the fatty tissue within the tush, and it absorbs slowly over the course of 4 to 6 months, kind of depending on dose and how many pellets. It slowly absorbs and it keeps the blood level really nice and consistent. So it's better than other bioidentical hormones, in my opinion, because you're getting a more steady blood level versus spikes with application of these hormones every single day, or shots that you apply or administer, once or twice a week. So that gives you more spikes in the hormone levels, whereas the pellets give it a more kind of consistent level within the blood over a longer period of time. It's also easier because patients are more compliant. You set it and forget it. So you don't have to remember to apply something every day or take a shot or take a pill. So it's a lot better for patients too. So what to expect when you're getting hormone supplementation for both men and women? You should expect increased energy levels, increased libido, mood stability, better sleep quality, increase in muscle maintenance and body mass. I think that's a big one, lean muscle mass. So those are things that you can expect to see, fairly quickly after starting supplement therapy. I think usually within 2 weeks you start to notice changes in how you feel. And so it's definitely worth trying. If you are interested in learning more about bioidentical hormone therapy and you think you or someone you love might be a candidate, please give us a call. We can have you come in, meet with me, and we can go over your lab values, discuss treatment options, and figure out what's best.